Okay. Well, good morning, everyone. I'm really pleased to be here. Really honoured, actually, to be helping kick off today's conference. And I guess what I'm hoping to try to do is frame some of the context of today's conversations and presentations around this particular agenda. Kind of talking about the journey we've been on at Sport England in this space, how we work and continue to work with and through many partners, and I guess where we're going next. Probably a familiar slide that we presented a few times, but for those of you familiar with our Uniting the Movement strategy, 10-year vision, first time Sport England's ever had a 10-year vision around sport and physical activity, and importantly movement as well. And in the consultation and the sort of the co-design for that strategy, that involved thousands of places and partners involved in that, there were 5 clear, what were described as big issues or areas of focus that the strategy, not just Sport England, but the strategy really needed to step up on and address. And I guess I'm going to speak about that connecting with health and wellbeing a little bit more overtly today. But it's clear to see that actually in terms of trying to create a healthier and happier population, it's important that we achieve all of these issues. These aren't islands in themselves. These are very interdependent. You have to create positive experiences for children and young people. We have to create the right environments to support people. They are, for me, some of the fundamental building blocks. So it's important to see this not in isolation. And I thought actually a really helpful place to kind of kick-start some of this would be to start to look at our Active Lives survey. So one of the biggest national surveillance programs in the world around physical activity. And I'm going to hone in a little bit on some of on people living with disabilities and long-term health conditions. Clearly, it's important to recognise that this is not the only audience we need to be thinking about when we're talking about part of the theme of today around prevention. But there's a really big, important piece for me around, particularly the report, if any of you saw it from the Health Foundation, around their vision for health in 2040. And it talked about 2.5 million more people living with major illness by 2040 than in 2019. 2.5 million more. Part of that down to an ageing population, but we also recognise the likely strain that's going to produce on health and social care if we do not try and think about this through a prevention lens. So, kick us off. Starts with a bit of a good news story, in that for this particular audience, people living with health conditions and/or a disability, we've actually seen activity levels bounce back to pre-pandemic levels, and we saw, unsurprisingly, this is well documented, a real dip when it comes to activity levels through the pandemic for all sorts of reasons that many of us are familiar with. So whilst this starts to paint a picture of, okay, we're kind of getting back to some of those areas that we were, and that's really important around how we support people in the right way, this is looking at people that are achieving 150 minutes a week. So recommended guidelines, where we know the optimal health benefits can be achieved. And what this graph kind of shows is actually at the top there, that sort of lighter blue line, that's looking at people without a disability or health condition, and at the bottom it's those with. So you're still significantly less likely to achieve recommended activity guidelines if you're living with a long-term condition or a disability. But really importantly, what this is also showing that for both groups, as I say, back up on activity levels up on 12 months ago, back to pre-pandemic levels. But importantly, for people with a health condition, significantly increased levels of activity since baseline, so back in November 15-16. So this is thinking about ways to support people really that works for them. So we start to dig a bit deeper, and we start to look at number of impairments. And this is important as well. So at the bottom there, we're looking at people living with 3 or more impairments, and at the top, someone living with 1 impairment. And this is self-reported data, I should add. So you're still and the navy box is looking at the proportion of people that are inactive. And so we can see there, I'm not sure it's actually not come up on, has it come up on the screen? No, it's not quite come up on the screen, only showing 2 there we go, I haven't clicked the button. So we've got 3 there. So this is showing at the bottom there, you're significantly more likely to be inactive if you live with more impairments. And thinking back to that Health Foundation report, that's really, really important. Because of those 2.5 million more people living with major illness, projections by 2040, we know a significant proportion of people are going to be living with comorbidities and increased real or perceived barriers and challenges to becoming active. So this really cements for me around the importance of working with people holistically to support them to be active in ways that really work for them. And we move on to socio-economic background and classifications. And this is where this intersection of data is really important, and we're not just looking at this through the lens of someone with a health condition or a disability. And what this shows is that actually the lower socioeconomic classifications indicate higher levels of inactivity for people with a health condition or a disability. So you're significantly less likely to be inactive and more likely to achieve guidelines if you're in those higher socioeconomic classifications. And then we move on to some of the wellbeing markers, and this is something we started to look at in the Active Lives survey back in November 16-17 in that data set. And in the top there in the blue, what you can see is this starts to show, compare people with and without a disability or a health condition, and it shows that actually if you live with health condition or disability, you are significantly more likely to report feeling anxious and feel lower levels of happiness, life satisfaction, and life worthwhile. And then if you're just looking at this audience and you compare where we are now to baseline, we can actually see that anxiety levels are up and happiness, life satisfaction, and life worthwhile are down. So it paints quite a sobering picture. And what we know is so important about being active is levels of enjoyment. And we look at positive attitudes. We ask people about how much they're likely to agree with whether they enjoy the thought of or being active. And we can see here that actually since 18-19, when we started looking at this, that actually the proportion that are likely to agree is slightly down and the proportion that are likely to strongly disagree is up. And these are statistically significant findings. So this reiterates the importance, and we take it for granted, you've got to enjoy it to want to do it or to keep going with it, but this is really important that we continue to think about enjoyment at the heart of becoming and staying active. So, this slightly busy slide I'm going to talk through, but at the top there in the black box, what that starts to paint a picture of is what the commitment was in uniting the movement. It talked about strengthening connections between sport, physical activity, health and well-being, so that more people can feel the benefits of and advocate for an active life. And we started to break that down into sort of two key pillars in those green boxes there. This is about using physical activity to unlock health for everyone, keeping people healthier, happier for longer, delaying the onset of major illness or disease, keeping people mobile, more independent. But we also recognise this is not an equal playing field, as I've just shown through some of the data set and some of that interconnecting data. And therefore, one of the pillars of uniting the movement is proportionate universalism. And so we are unapologetic in looking at a disproportionate amount of resource to support people who are inactive to move more, because we know that's where the greatest health gains are made and where we can have the greatest impact on reducing health inequalities as well. And in these pink boxes, we started to think about where do we want to be by 2031? What should this look like? What should we be aiming for? And so with partners, places and colleagues across Sport England, we started to think about what some of those outcomes should be. And this actually is a little bit iterative. The more we learn, the more these kind of iterate. But we absolutely want to have the right evidence that inspires change. We're not short of evidence around the health benefits of being active. We continue to see more, and that's really important we do. But is it getting to the right people? Is it the right evidence that's instigating the change we want to see? Is it being advocated for with the right language and in the right way that really speaks to those we want to influence? And do we have the right people and the credible influencers that can actually start to talk about the right evidence? We want more organisations across different sectors using sport and physical activity to improve health. Something I'll come on to shortly. Absolutely, physical activity, sport, movement should be a core part of health and care systems. Be seen as part of the solution, not a bolt-on. We recognise there's more to do around the pathways between health and care and into physical activity, not just organised sport and activity, but in unstructured ways of becoming active. And probably goes without saying that it comes back to that the enjoyment piece. It has to be a positive experience, particularly for people at risk of or in poorer health. So, if that's 2031, where do we start? What do we do? How do you chunk that down? And so for many of you be aware that Sport England published an implementation plan, first action plan that kind of ran from 22 to 25, and we started to think about what some of those building blocks are, which I will come on and speak to a little bit more. But the first one is around making sure we can influence, and we continue to, and this is not a standing start, influence those working in the NHS and social care to prioritise physical activity to address health inequalities. And this is speaking to people's hearts and minds. This is having the evidence, it's having the science, but it's about telling the right and the most powerful story. We know actually we need to improve that pathway between health and organised activity by reducing and removing barriers associated with risk. And this is absolutely integral. We know that risk and fear and perceptions of worsening or exacerbating symptoms is driving many behaviours and decisions, particularly across healthcare professionals, because we've learned this, they've told us this, for fear of the adverse effect that might have on the individual. And we also know there's real challenges for many individuals living with health conditions around what that might look and feel like for me. Will it exacerbate and worsen my symptoms? And we know that for the sport and physical activity workforce, there is also a fear of supporting people of different levels of need. But this isn't just that sort of story. We know there's brilliant work going up and down the country, but it's about actually making this a lot more consistent. And finally, championing the role that sport and physical activity plays in supporting mental health and wellbeing. We know the evidence is strong there, particularly for some of the prevention piece, but we know there's a lot more work to do to actually make this the norm, particularly as we come back to those NHS and care systems. So what I thought I'd do, I'd just talk through some of the work and the partners we are working with at the moment to try and drive some of these opportunities for change, those 3 opportunities for change I've just talked about. And what you can see up there in the middle, that active partnerships remain a critical system partner to Sport England and have been for many years. But I guess for me, this feels like it's just really dialed up over the last few years. We know active partnerships are doing some unbelievable work in this space to build and mature relationships with health and care systems. And there's some fantastic work going on, but it's not necessarily happening everywhere. So we really are working closely with the network to understand how we can better design physical activity, movement and sport into health and care. And we've actually done some insight that we're going to be, we've got an event up in Greater Manchester next week, I think it is, back end of next week, where we've painted a picture of what's happening across the country, something we haven't had before, some insight across all active partnerships, which will really help us understand what's happening where, what we can learn and what we can spread and scale, and who those critical partners are. We also work with NHS Horizons, and we've done this with OHID, the Office for Health Improvement and Disparities, over the last few years, thinking about, and NHS Horizons are absolute experts in large-scale system change, particularly within the NHS, really understand what is a very complex and layered landscape, and quite a complex policy landscape as well. But actually helping understand where those opportunities are, to speak the right language, to open those doors, to have those conversations has been absolutely invaluable. And we'll continue to work with NHS Horizons over the coming years. And these are a partner for all of us, not just Sport England, in helping us understand that landscape and actually navigate through it. We also work with NASP, the National Academy for Socialist Prescribing, and we've invested in physical activity at a national level, as well as a team of regional coordinators that have started to look at how we embed physical activity into social prescribing across the country. And as you can see around here, the Moving Healthcare Professionals programme, which many of you probably may be familiar with, is actually the many facets and pillars to that, including the Clinical Champions programme, for instance, has been a real roaring success, really. You know, it's been something that's really driven a lot of the right conversations, training, and culture and system change across the country with some of this. And I've just outlined, you know, the Active Hospitals programme, about whole systems approaches to embedding physical activity across hospital and secondary care, and how we're spreading and scaling that. The Moving Medicine website, if you've not been on the Moving Medicine website, has been developed for healthcare professionals, but there's just an incredible amount of information, evidence, and tools on there that I think we could support all of us. The Royal College of GPs continue to drive the active practice work and the toolkit that sits behind that. Hundreds of practices across the country have signed up to be an active practice. It's taken a whole practice approach to increasing levels of activity and reducing sedentary behaviour amongst patients and staff. And that latter bit is also critically important. And then this slightly random UK Parliament logo down at the bottom is just based on telling a picture, or telling a story, I should say, of we chaired, which Mike attended, a parliamentary roundtable a couple of months ago, a relationship building exercise really with those that we know hold some real influence and clout with government and with across the political spectrum, about how we can start to drive this agenda forward together. And one of the outcomes of that is actually how we can respond to the major condition strategy in the right way, together. Not Sport England responding and everyone else responding, otherwise we're coming across in a fragmented way, but what are some of the consistent messages, policy asks, changes we really want to see, and how are we advocating for that in a very consistent way? And that's something we're working closely with the Richmond group of charities around as well. So moving on then to some of the work around risk. So many of you be familiar with some of these visuals. We, with the Faculty of Sport and Exercise Medicine and the Royal College of GPs and OHID, published the consensus statement on risk back in 2021. And that looks at all of the scientific literature that underpins, well, what are the risks? You know, risk is a big barrier, but what actually are them? And what the scientific literature overwhelmingly told us is the benefits of being active far outweigh any of the risks. In some respects, you are safer being active in a way that works for you than you are remaining inactive. But we do recognise that the messaging and the support needs to be personalised. It's not the same for everyone. And we know that for many people with certain symptoms, there are particular messages and support that's required. So it's not a completely simple picture, but the overwhelming message is risk shouldn't be getting in the way. And I guess what this does, I should say, this paints the picture for change, that change is needed. And actually what we're starting to do now is go, well, actually, if we're going to create change here, if we're going to drive and accelerate some of this agenda, we need to be having conversations with the British Medical Association, the Medical Defence Union, the insurance sector for sport and physical activity. We need to co-design what some of these solutions are with the workforce and with many of your colleagues in the room to actually get this right. But for me, an absolutely fundamental piece of work. We've also worked with Sheffield Hallam University to develop the Easier to Be Active framework, which co-designed with people with lived experience and many stakeholders what a framework for positive experiences should look like. And they painted this picture of the 5 I's about being informed, inclusive, individualised, integrated, and to have the right influencers. So we're going to be continuing to do some work with the Active Partnership Network to drive some more consistency around pathways between health and care and physical activity moving forwards. A really critical, again, piece of work that builds on an evidence-based framework. And then finally, I know we've got Michelle and colleagues from the Richmond group in the room today that are speaking a bit later, but they remain a really important part, critical system partner for us, who have the reach and the credibility with for many of the audiences and communities that are really important to us. And we've also invested, and you'll be familiar with the We're Undefeatable campaign, which is a real platform for challenging misconceptions, for painting a really positive narrative around becoming active, for telling some really powerful stories for how it's worked for different people with different circumstances. And then finally, moving on to some of our work around mental health, just to paint a picture of a couple of things we're involved with. We are looking to embed physical activity into NHS talking therapies. I know there's some of you in the room that will be doing the same. And this starts to look at, and we know that the majority of clinical psychologists that we spoke to were saying, actually, the evidence is strong. Of course, physical activity should be somehow part of these conversations, but for about 98% of them, it wasn't. And there's a real opportunity, and we tested some work with 2 NHS mental health trusts to understand what that might look like, what some of the clinical impact and outcomes were, what the learning is around replicating this and spreading this elsewhere. And we've shared some of that learning, but we are looking to influence some of the National NHS Talking Therapies Manual off the back of that evidence, and we're working with NHS England and we've worked with NHS England throughout this, I should say, but this is something around what might the next steps be working together based on that evidence to start to spread and scale this work. Probably colleagues from Mind in the room as well, but for me, there's a really important system partner of ours who are, and I won't talk through all of this, but particularly driving some of that policy and influencing nationally, and who we know are providing a really invaluable support structure for the sport and physical activity sector, to be able to support people in the right way, to have the knowledge, the skills, the behaviours to support people living with a range of mental health challenges. And for me, this is something that's been an overwhelming success that we're looking to drive and work with moving forwards. And then just to say, I think a couple of other bits that we're working on, we are looking to improve. We know that we're a bit short on some of the robustness of evidence around where could physical activity play a role for children and young people that have got a mental health, who are in treatment or have got a diagnosed mental health condition. What is the role physical activity can play there? And actually, across that spectrum, where could we have some of the greatest impact working with colleagues and NHS England along the way? And we're looking at, actually, we know there's a lot going on, so this is also about understanding those case studies and stories, but it is also surfacing the gaps of where we can work together to invest, to where we, as I say, where we can have that greatest impact. So, a lot in there, and it's a bit of a whirlwind tour. But I thought I would just point to what are some of the success measures for this work, and what are we working on, looking to develop a bit of an evaluation around. We're looking to increase confidence, first of all, of the sport and physical activity sector and partners to be able to confidently advocate for physical activity and the role it can play in supporting health and care priorities. Increase confidence of health and care organisations and colleagues to prioritise and act upon physical activity in routine care. We want to show and demonstrate strengthened, trusted relationships between health and care colleagues and the physical activity sector. This is happening, and we'll be a lot of this talking today, but I guess it's better drawing this out and understanding what is it that contributes towards that trust, what really builds that. And what we know and we're learning is that's about working together across common and shared purpose and outcomes. We want to see more policy being influenced, so we want to see physical activity and sport referenced, not just referenced as being important, but a fundamental part of the solution to how we address and achieve health and care priorities, both nationally and locally. And finally, we want to evidence that risk-based barriers have been reduced. So we're actually seeing a more personalised, supported, smooth, easy pathway between health and care and physical activity and sport. So just some thoughts to take away and to think about from my perspective. What are, for you, some of the specific national policy changes that would unlock, accelerate, or amplify your work in this space? So often, when we ask around what role Sport England can play, we hear about changing and influencing policy, but we need to get specific. What do we mean by that? Where do we mean it? What could that look like? And for me, it's not us in the ivory towers, work with other partners. This is about being in listening mode and understanding some of those challenges and opportunities. So I'd love everyone to think about what some of those changes might be. What difference would the proposed work to reduce barriers with risk mean for you and your partners or your place? So if risk was actually, it can't eliminate risk, but if we're reducing it, if we understand it and we're supporting people around that, what difference would that make to practice and to policy? And finally, we want to hear from you. And that might be coming directly to us, but it's also who else can you liaise with to get more involved in this agenda or feed your thoughts through to? Because it's that collective voice and the power of that, for me, is really important. So that might be Active Partnership. It might be coming to us, the NGB. It could be UK Active. And there's many other representative organisations and bodies to speak to. But it's really important that's fed up. Thank you.